and I am now a specialist orthopedic surgeon working in Germany. If you've seen my previous videos, I've always said I am a doctor working in Germany, I'm an orthopedic resident working in Germany, but now I'm a specialist orthopedic surgeon working in Germany because I have passed my Facharzt exam last week. Now, what is a Facharzt exam? Facharzt exam is a completion of specialist training exam. Okay, similar exams we have in other countries also when you completed the number of years of training and then you take the exam. Like that, in Germany we have Facharzt exam. The duration of training in orthopedics and trauma in Germany is 6 years. From the 6 years, first 2 years are common trunk which can be done in any surgical branch. Okay, it can done in orthopedics as well. In those 2 years, you have to also do 6 months in Notaufnahme. Notaufnahme means the emergency casualty department, which you may call it in English. And 6 months have to be done of intensive station, that is ICU. And the rest 4 years have to be done specifically in orthopedics and trauma. After completion of these 6 years, you have to submit, you have to maintain the logbook all the time during the entire 6 years, and that logbook has to be submitted to the medical council and you have to apply for the exam. They analyze your logbook, they go through everything that you completed, everything that has been was prescribed in the curriculum, and then when they find that everything is in order, then they will invite you for the exam. There you go for the exam, and then there are two senior orthopedic surgeons sitting over there, and they will give you different cases, ask you questions, how to manage that. The different, every candidate faces different kinds of questions. The exam is approximately 45 minutes to 1 hour. Sometimes it's also like little less than that, but it does not go more than 1 hour in most cases, in general cases. So with me also, exam was around 40-45 minutes, and there were two senior surgeons sitting over there, and they asked me several questions. They presented several cases. I'll not go into details of those cases because that might not be of your interest at present. But the exam, I would say with my experience of the exam, I say the exam in itself is not very difficult, but the preparation that you have for the exam, that you do for the exam, that is so intensive that there is certainly a difference in your knowledge before, when you are just a resident, and on the day of the exam. There's a huge difference in your knowledge, in my opinion. That was at least in my case. So that you study seriously for the exam, and then and that shows in your exam. In the exam, the cases which you would have otherwise 6 months back not really answered very well, you are prepared for those because you have studied so well. So that is, I believe, is the intention of this exam, that they don't want to grill you on the exam, but they want that you prepare for the exam so that the next day from the exam, you are ready to work as a specialist orthopedic surgeon independently. Now, I fortunately passed the exam in first attempt, and I'm very happy about it. Now I work as an orthopedic specialist, a Facharzt in the hospital, and I'm working towards joint replacement surgeries, or the endoprosthetic replacements in adults. And yeah, this has been a good, a couple of weeks, I would say. If you have any interests or any comments about orthopedic training, any questions about orthopedic training in Germany, write that in comment. If you like the content of this channel, the content that I present, please subscribe to this channel and like this video. Share this video with other participants, other candidates who would be interested in orthopedic surgery in Germany. And I'll see you in the next video. Have a nice day.